Here's everything I'm looking for when I help my patient latch their baby to make sure we have a good, effective latch as a high-risk labor postpartum nurse. I teach my patient to keep an eye out for something called a feeding cue. If we have a baby that is medically stable, full term, we are not gonna put this baby on a rigid feeding schedule like we used to do in the old days. If they're acting hungry, we wanna feed the baby when they're hungry. Go figure. If I were to stroke the baby's cheek and they're kind of rushing towards my finger or rooting and chewing on the blanket, these are all early signs of hunger. That's a great time to unswaddle the baby and start working on a latch. If I were to put a gloved finger in the baby's mouth or a pacifier in the baby's mouth and they're sucking and sucking, that is just a reflex. That does not necessarily mean they're hungry. Number two, when it's time to latch the baby, in most cases, I like to completely unwrap the baby, open posture, splayed out. Once the baby's unwrapped, I take a look at mom's nipples and I make sure they are poking out. We call that everted. It can be a little bit easier for the baby to like grab onto and remove that milk. Flat or inverted nipples, there are things we can do that may help. Now that we have an everted, poked out nipple, start at the nose, drag it down towards the baby's mouth. And bonus points if we're able to get like a drop of milk or colostrum. The scent of milk and colostrum is pretty similar to amniotic fluid. Baby is drawn to that. And she's gonna open her mouth. Now, if she's just opening her mouth a little bit like that, if she's just sort of biting or sucking on the tip, they actually will compress the end of the nipple. It can close some of the holes where the milk comes out of, and it rubs and damages the tissue. We're not gonna have good milk removal. It's gonna be painful. You do not wanna commit to a latch just painful or shallow. You wanna wait until she has a big, wide, open mouth, like when you're about to like bite into a hamburger. Like that is when we're gonna go for the latch. Take that nipple, aim it down to sort of help keep that chin open so she keeps a nice wide latch. When she's on, if I look at her profile view, it is a nice wide angle like this. And then I take a look at her lips. I kind of want them to be something called flanged. The lips are sort of rolled up and out, kind of like a duck. It ensures that we have a nice tight seal around that nipple, effectively roll and remove that milk out. If I do see that the baby has a nice wide big latch, but maybe the lips are just a little rolled under, we can just put a little bit of gentle pressure on the chin. It will roll that lip out. So we want to make sure that we're responding to those early feeding cues, that the baby is unwrapped, their arms are not getting in their way. We want a nice everted, poked out nipple, however that needs to happen. Big wide hamburger bite latch, ducky flanged lips. These are all things that I'm going to be keeping an eye out for when I'm helping patients latch their baby. When I was latching my own 3 kids, if at all possible, link up with a lactation consultant so they can see you and make a plan that works for you guys. For more information on pregnancy, birth, postpartum, babies, can you follow, check out my page.